Now we'll discuss heat setups. What's important to understand is that we start patients' visit with heat, so that way we can warm up their muscles and bring blood flow to the area. This will help with pain management and also with treating that area, especially for the therapists who are doing hands-on care. It can literally help to loosen up and soften up some of those tissues that we'll be working on. One thing that's super important is that we're very particular in these setups because, as you can imagine, heat might get to a point where it becomes dangerous or even create injury within a patient. And we want to avoid this if at all possible. So this is our area for heat setup. These are called hydrocolators. They're filled with boiling water and they have clay-filled heat packs within them that we can pull out and place inside covers. Now there's a certain amount of layering that we have to have between the heat pack and the patient's body for it to be safe. And this is dependent on the position. For example, if they're laying on top of the heat pack on their back, we need to add an extra layer of cover so that way we prevent them from getting burned. Now even beyond that, if a patient were laying on heat and you notice that they complain, this is feeling a little bit hot, we welcome those complaints and we welcome that input so that we can make adjustments to what setup we have for them. In fact, as I referred to later in our flow sheet video, there's even a spot to indicate if we need to place an extra towel or an extra layer for these patients. So let's start with the setup. What you'll do first is you'll grab the cover. So if I'm setting up a lumbar heat pack, I'll grab this large cover. I'll place it down, and then we have tabs that you can grab on these lumbar heat packs in the larger of the two hydrocolators, where you can grab those without having to put your fingers in the water. Please make sure that you're not putting your fingers in the water. It is boiling hot. We want you to stay safe. So once you let a few drips drip down, you throw it over like that and let the Velcro seal up right there. If I was going to place this wrapped around somebody's hip or on top of the patient where they're not putting their body weight on it, I would just do this cover and I'd grab one of our larger towels, fold it in half, and I would place that on top, and that's ready to go. Now, if a patient needed the extra layer because they put their body weight on it, for example, if they were laying on their back, I would place an extra cover. This is a smaller, medium-sized cover on top, and then the same doubled towel. Now that's ready to go. As we said before, if a patient needs extra layering, we can add either an extra doubled up towel or, if necessary, even another cover. Now, if we had to do a different setup for a patient where we cover a smaller area, rather than using a lumbar heat pack, we would use a cervical heat pack. And you'll see that both the covers and the heat packs are smaller. They're here in the smaller hydrocolator. Now these don't have tabs to grab, so please use these tongs here to avoid sticking your fingers inside the hydrocolator. Again, you want to make sure it drips off. Place it there on the pad. Always try and keep those hydrocolators shut between treatments so that way they can get nice and hot. So you tuck it in like so, placing this cover here, and then fold the flap over the top, just like that. For these covers, we have a smaller towel. We throw it just like that and tuck it underneath. Now that's ready to go for the patient. This will be used more for draping over people's shoulders, like so, or around necks. We also use these on the ankle. We use it to wrap around, usually in either around the ankle itself or just the foot, or we can do what's called a figure 8 setup that we'll show you here in the next video. Now let me show you the flow of what a heat setup might look like. As a patient walks in, you hear the door ding, and that'll alert you to reach in and grab their flow sheet. So for example, on this patient right here, you can see that they have low back pain. So I'm going to look at the card to see what the setup is. So you can see here that they're in a seated position and that we're going to use a lumbar heat pack. And you can see over here, just like we talked about in the flow sheet video, that you can see where the heat needs to be on their lower back area right there. If I were to have pulled this card, you can see that they're in a seated position and that they have a stim setup and that we're going to use a cervical heat pack. You can see on this region of the body circle that'll be wrapped around the backside of their neck. We're going to pretend like these both said supine positioning, and I'll get Zach set up on the table here as our patient. So once I see those cards, that's going to cue me to walk over and get those heat pack setups ready to go. And then I'm going to, once I have those ready to go, I'm going to reach out to Zach and call him back for his visit. So let me show you how that looks. Ding! Got the chart, grab the heat setup. Now I'm going to walk over to the patient. Zach, come on back. I got your heat ready. Oh, yeah? Been up to anything different this weekend?
Oh, I did a lot of hiking this weekend.
So for cervical heat pack, I'm going to sit this right here at the base of the pillow. Go ahead and lay down on that for me. Darn, is it more than normal, or is it something else that you're doing that set it off? I'm going to pull up like so to make sure that it wraps around his neck nice and tight and snug. And then there's a Velcro right here that I'm going to put in place. I'm also going to push it down just to make sure it's set. Then I'm going to grab a bolster. Go ahead and lift up your legs for me. I'm going to throw this underneath. Good. How's that feel? Is that comfortable?
That's amazing.
It's always important to check and make sure the patient is comfortable. That way they don't feel like the heat setup is torture, but it actually feels really nice. So I want to make sure his legs are propped up in a comfortable position, taking into account how far away I place that bolster from his rear. And then I also want to make sure that this isn't choking him in the front, but it is snug. So that's why I recommend coming here and pushing down the heat pack on top of the shoulders. That'll allow it to feel snug back here without feeling too tight on the neck setup here. So Zach gave me some good communication there that I would share with his provider about his back feeling a little bit more sore today. That might disrupt or change some of the things that we would normally do. So we'll make adjustments to his program today. So I come get him off. I get the Velcro off. I place that down. Let's go ahead and lift your legs up for me. Good. And why don't you come on and sit on up here for me. So I'm going to stay close by, making sure he's doing okay. Coming from a seating position back to a standing position. Make sure he's okay. Make sure the table's not tilting at all. Good. How are we feeling?
Much better.
Good. And at this point is when I'd get him set up for the provider to start working with him. Now let's say it was a lumbar setup for him. I'd call him back in the same fashion. And I'd place his heat setup right here. I like to make sure it's snug right up against the pillow. That way it can hit everywhere it needs to on the back. Go ahead and lie down for me. Nice. And I made sure to have an extra layer here since he's laying on top of it. All right, go ahead and lift those legs up for me. Good, and relax down. Wonderful. Does that feel okay for you?
Perfect.
Good. Making sure to check in that he's comfortable. Now, one thing to take into account is that some people can't lift their legs up onto a bolster, so you may even have to kind of scoop under with one arm while you slide the bolster underneath their legs and then help them rest their legs on the bolster to prevent back pain. Another thing you might have noticed is that when I did the lumbar setup, I had his head over here. When I did the neck setup, I had his head over here. Why did I do that? That's because if I was going to get the cervical heat pack off of him, I could just lift his head up, take that out, place it back down for the provider to be ready to work with them with their pillow over here, making sure that we have room for a stool for the provider to do any hands-on work they needed to do. Whereas this setup, typically we're bringing them off the table for a provider to work on them. So we're setting ourselves up for a better, smoother flow as well. Go ahead and take a seat here, Zach. So we went over the supine lumbar setup. The difference here is that you would remove one of those covers for a seated lumbar setup. The lumbar setups are the same for the thoracic setups of the mid-back. You might just go and lean forward and then back again. You might just shift it up maybe an inch or two, but there's not much difference there. Sometimes with this, we'll have them up against the wall. You might even have a pillow back here to prop and support, make sure the heat's getting the upper back there. So that's what a mid-back setup would look like there. Now for a seated cervical setup, it's the same principle where you want to wrap around here and make sure it's flush on the back. Then you're going to wrap around the front here, find that Velcro, and make sure it's here. Does that feel okay?
Great.
Okay. If they say, great, then you probably did it too tight and you don't want to do that. Okay. If I were to do a hip setup, again, I'm going to take that extra cover out, and we could either do it in a seated position or a side lying position. Go ahead and stand up for me, Zach. When I do a seated position, I'm going to set it up kind of in the corner of the chair. I'm going to have him sit back in so that his rear gets the heat and the backside of his hip. Then I'm going to wrap it over like so. I'm going to grab a pillow and I'm going to shove it right down in here. And then he can rest his arm on it so his arm doesn't get too hot from the heat as well. So that way it's nice and snug, wrapped all the way around that hip. And like we said, if I was going to do it in side lying position, Zach, I'll have you come up on here on the table. If I wanted to treat his right hip, I'd say, go ahead and lay on your left side, so you're going to be facing me here. I'd throw this pillow between his knees. We always want to put it between their knees for extra comfort. And then I would use this to kind of drape the towel and the heat pack over the side, making sure it gets the back part of the hip, the side of the hip, and into the front part of the hip, wrapping around. Sometimes this might be a little too heavy for a patient, so you might see that a provider indicates that we use a cervical heat pack instead. Or if it's too far inside the groin, you also might see that a provider uses a cervical heat pack. For knee setups, you'll notice that there's a few different variations, especially if they just had a knee replacement. We'll want to make sure we do something where we place the bolster in retrograde. That means the part that's underneath their knee is the shorter part of the graduated bolster. So Zach, go ahead and roll onto your back for me there. Good. So here's our graduated bolster where the top end is skinnier than the bottom end. So if I'm going to do a retrograde setup, I'm going to have the skinnier end underneath his knee and the taller end underneath his ankles, so that gravity can pull down any of the swelling in his knee back toward his heart where we want it to be. Then I'm going to take the heat pack, only has the cover on it and the towel. I'm going to lay it mostly over his quads, the front muscles in the thigh, and over the top of the knee. That's because when we're working on knees, especially total knee replacements, we want to make sure to heat up those quads, as those are the things that tend to be the tightest and prevent us from getting normal motion the most. So I'm always going to ask if that feels okay. Sometimes we have to be mindful of the pressure on the kneecap here, so just make sure to check in on them and assure them that they can pull anybody over that has an M on their uniform to make sure that they have the right setup and that it's not getting too hot. So this is what it would look like in supine with a retrograde setup, or at times we do it in a seated position. Zach, let's have you back in the chair. These are our more standard bolsters where you can see it's a square or rectangular block shape. Go and lift up your leg for me. I like to do it on the taller side because you can see that that's the same height as our chairs. And you throw that over the knee and into the quads, always kind of molding it on to the patient. I make sure that the bolster is underneath the knee unless otherwise indicated, so that the knee has support. Sometimes we'll have the bolster not be supporting the knee, so we can work on that straightening or extension of the knee with the extra weight of the heat pack. So for the shoulder setup, you'll notice that I put a pillow underneath to prop. That adds comfort to the shoulder. And then I'll prop this over the shoulder. Go and sit forward for me, and then right back. So I make sure to mold that heat pack all the way around the shoulder, so we get heat to the front, to the top, to the side, and to the back of the shoulder. There's important structures all throughout the shoulder that we want to make sure get access to the heat. Does that feel okay?
Perfect.
Awesome. Okay. Then we'll adjust down just a little bit more for the elbow. This will apply really for the elbow, wrist, or hand, this same principle. I'm going to wrap it around here, and I'm going to wrap this on the bottom side, if you can see that on the bottom side. And then I'm going to wrap this over on the top. Now the great thing about this is that you don't need a Velcro to strap in. You can just use the weight of the arm into the pillow to have that nice and locked in and firm there. How's that feel?
Great.
Awesome. And then if I was going to do a setup for the foot or the ankle, you'll see that the provider should indicate what the focus is, either just the foot, just the ankle, or both the foot and the ankle. If we're doing both the foot and the ankle, we use a technique called the figure eight. Go ahead and lift that up for me, and right back down. Perfect. So the way to do this is I always like to start on the top of the ankle with the non-Velcro side, and then I'm going to cross the bottom of the foot and right back over here. So you can see the heat pack got all the way around the foot here, and then all the way over the top and the back side of the ankle. Okay. So one thing that you always want to do is you'll want to have one of these straps to help you strap this in. So I let it come like this, place it over the top, stretch it in, and I follow that same pattern that I just locked it in with that figure eight formula there. Oh, yeah, no, it's all good. So that way it can be snug and stay in place and not fall. it's hard to rely on the Velcro for these, so always make sure you use the extra strap there. So that's if we're getting the foot and ankle. If I just wanted to get the ankle, I'd come in like so and just wrap it all the way around like so. Throw this over the top. And strap it down nice and snug there. If it's the foot, I would do the same thing, just onto the foot there. Something important to understand about anytime you're using a cervical heat pack or ice pack is when you're placing it on the shoulder, there's a flat side and then there's a curved side. When we place it for a shoulder, we'll want the flat side close to the neck so the curved side can wrap down around the shoulder. And when you place it for the neck setup, you'll want the curved spot to go down so it can get some of those muscles at the mid back.